Hello, everybody. I think we're just coming live now. So welcome to our question time, COVID-19 and vaccination. I'll just wait for the meeting to fill up. And I'll be doing some introductions in one moment. Thank you all for joining us this afternoon and for your interest in what has to be one of the biggest topics for kidney patients at the moment, which is COVID-19 and, of course, vaccination. We've had a record number of people who've joined today, so I can see that we've got over 300 of you joining us already, which is fantastic. As you join, just take a look at the Twitter hashtag, which is COVID question time, if any of you want to share that you're joining this afternoon. And you're very, very welcome. What I'm going to do then is if Julie could just move on to the next slide. We're going to do some introductions and explain to you how the event is going to work this afternoon. First of all, if you look at the bottom of the screen, I'll introduce myself in a minute, by the way, but if you look at the bottom of the screen, you can see the number of participants, you can see something called chat, and you'll be able to see something called Q&A. So this meeting is being recorded and it will be available on our YouTube channel with subtitles, should you wish to use them in a few days' time. The next thing to say is that we have had a very, very large number of questions coming through, unsurprisingly, and we will do our best to address them through the webinar itself, through the kidney doctors we've got lined up for you this afternoon. But also, we do expect to get lots of questions being asked through the Q&A box at the bottom on the right-hand side there. But what we would ask you to do is, if you think a question is really important, you can upvote it by, there's a sort of thumbs up next to the question, and click on that, and that will bring it to our attention so we can make sure we try to answer that question live. So also what I'd ask you to do is just take a look in a minute at the areas of questions we're going to be addressing this afternoon so that you can see whether those areas are likely to cover the question you had. Because if we have hundreds of questions live, we'll be rather challenged to be able to answer them all as we go. So, as I said, any technical issues to the chat box, do upvote questions that you like. I'd like now to go on to the next slide, please, Julie, and introduce the team of us who are with you this afternoon. So due to popular demand, we didn't have just one or two. We now actually have 5 kidney doctors that have come online to help this afternoon, which we're incredibly grateful to everybody. And what I'm going to do is ask the panel members to put themselves on live as I introduce them so you can see what they all look like. And first of all, we've got Dr. Rebecca Suckling, kidney doctor, associate medical director, and lots of other things at Epsom and St Helier hospitals. So I don't know, Becky, if you can show yourself on the screen there. And there she is, and while you're doing that, Becky has been fantastic supporting us through these previous webinars, and she's got some very, very fast fingers. So she's going to be answering as many of the live questions as she can. And next to her, I'm not quite sure where she's on the screen she's on the screen at the moment. All right, we're going to see it. There's Dr. Fiona Harris, clinical director and also kidney doctor from Epsom and St Helier, and she is joining Becky to help answering all your questions. So thank you, Fiona. Thanks, Dr. Harris, for joining us at very, very short notice to act as an additional pair of hands this afternoon. Brilliant, thank you. Next, I'd like to introduce Dr. Joyce Papoola. If you can, where are you? I just thought I saw you there. Oh, maybe that was.
Well, I'm here.
Brilliant, there you are. So here's Dr. Joyce Popoola. So she is from St George's University Hospital. Again, she has all sorts of things that she's done, but she's especially interested in transplantation, immunology, renal disease, pregnancy, and pediatric to adult transition, and lots more things. So thank you, Dr. Popoola. Thank you, Joyce, for joining us this afternoon.
Okay.
We've next got Dr. Andrew Frankel. So if Andrew, if you could show yourself on the screen, that would be great. And he's at Imperial College Healthcare Trust, and there he is. And he'll be kind of opening us up in a minute with bit of a summary type of thing on here as well. And then finally, from the medical side of things, We've got Professor Richard Haynes, who's a kidney doctor at the Oxford Kidney Unit, and I hope he's joined us. He was, if you're there, Richard, please do wave on the screen. There you are, great. So he was also on with us previously, and you'll know that he's done a lot of work on the recovery collaborative group. So he's got lots of research experience as well, which is super. So thank you everybody for joining us. And then from our own teams, we've got Julie, who's helping with the technical support for all of this. And then we've got the Kidney Care UK team. So that's me, I'm Fiona Loud. I'm the policy director for the charity. I'm myself a kidney patient, as I think many of you will know. I spent 5 years on dialysis and I had lucky enough to get a transplant from my husband 14 years ago. I was also very fortunate to be able to get myself vaccinated on Saturday after being invited by my kidney unit to go and do that alongside a large group of other people who've had transplants or on dialysis. So I think without further ado, just to remind you, please put the questions in the Q&A, but please hold on to listen to what we're talking about in the areas first, and only technical stuff in the chat. So if we could go on to the next slide, please, Julie. I'm just highlighting these are the areas which we've been asked questions about, and we'll endeavour to cover in a range of different sections with different speakers this afternoon. So the first one will be about which vaccine is best for me, how well will they work, and about new variants. We've had questions about the first and second doses. So I put new variants in there twice because obviously we're very keen to get some answers about new variants. Children and pregnancy, side effects and safety, allergies and interactions with other medications. What should we do after being vaccinated? And what about the vaccine prioritisation and rollout? What about our family members? And then a range of questions for about people with one kidney and living kidney donors. We know that vaccination is really, really important to all of you, and we know that you have lots and lots of questions. So what I'd like to do is just to hand over now to Dr. Andrew Frankel, who will open up with a sort of summary and a few things about where we are. So Andrew, if I could give you the floor, that would be great. Thank you very much.
Thank you very much, Fiona. And I'm so delighted that we have so many people who have joined in on this call. And I really hope that you're going to find this useful. Since we had our last webinar, I think it must be some 6 to 8 weeks ago, there's been an enormous amount that's happened. In the first instance, as I'm sure you're all aware, there has been a real surge in COVID. We are now in the midst of a national lockdown. We've also had the worrying appearance of new strains. And I say worrying because there's so little that we understand about this at the moment. Although to some extent, please remember, this is exactly what happens with a virus like COVID. They do get new strains coming all the time. This is really affecting the renal community. People who have kidney disease are suffering from COVID and are developing COVID, and unfortunately, a small number are coming to harm, which is what we want to prevent. And in this environment, we all have to continue to follow the rules. We all have to continue, if we are shielding, to shield, and all of us adopt safe behaviours, limiting our travel, keeping space, washing our hands, and so forth. However, in the midst of this somewhat gloomy introduction, we now have a series of vaccines which are being rolled out and administered across the country, and now including the kidney community. And this is something that actually does appear to be moving forward relatively quickly and speedily. There is a very great amount of information available about vaccines that's probably coming to you through a whole range of sources on the internet, social media, on the television, in the newspapers. There is so much information and there's so much changing information. And I would suggest to you that unfortunately, a lot of what you are seeing out there may not actually be accurate information, and some of it is actually misinformation. What we would like to do in this webinar is ideally, we want to reassure kidney patients, whether you are dialysis, transplant, whether you are patients on immunosuppression or patients with advanced kidney care, advanced kidney disease. We would like to reassure you that the vaccine is both safe and effective. But we also understand we can't just simply say this. What we really need to do is to listen to your questions, hear what's going through your mind, and answer as many of the questions we can based on what is fact and knowledge. And I hope that that's what we will try to do, and that's what we will achieve in the course of this hour-long webinar. Fiona, would you like to take that forward now with the...
Thank you very much, Andrew. That's great. Thank you for the introduction. And I can see the questions are starting to build up, but I think it would be really helpful for people just to hear some of the answers we're going to be giving, because some of the questions you've rightfully asked have been the ones we've also heard in advance of this afternoon. But at the same time, do upvote, give a thumbs up to something if you think it's incredibly important to hear the answer this afternoon. We hope we will cover all of them, and we're certainly going to do our best. So what I'd like to do then is I'd like to move to Richard, so Richard Haynes, Professor Haynes, and what he's going to do is he's going to speak a little bit about some of the questions that you've had about which vaccine is best for me, and the kind of differences in how well they work and suitability for kidney patients with those that are available at the moment. And that includes questions about sort of current immunity levels, and some more questions about higher efficacy between vaccines and wanting to have one vaccine or another. So there's a range of questions there. And I wonder, Richard, if you'd be able to just address some of those. Thank you.
Okay, thanks, Fiona. It's a pleasure to be here this evening. So there are largely two main different types of vaccine available at the moment. There are vaccines called mRNA vaccines, and that includes the Pfizer vaccine and the Mrna vaccine. And then there are some what are called viral vector vaccines, which is what the Oxford vaccine is based on. They work differently in some ways, but essentially what they both try and do is to get your own body to produce one small part of the virus, and that being the spike protein, which you might have heard about on the news. It's the bit of the virus which is the way that it gets into your own cells and infects you. So if these vaccines can persuade your body to produce that, then your body can then generate an immune system against the spike protein, which means that if your body then later sees the real coronavirus, it will have antibodies and cells ready to fight it. So they work in slightly different ways, and the trials which have been done show that all of these vaccines work very well indeed. So you will have probably heard in the press that the Pfizer vaccine is, say, 90 or 95% effective, and the Mrna vaccine is similar. And what that means is that if 100 people might have got infected after vaccination, maybe only 5 or 10 of them do. So it protected 90 to 95 of those 100 people. And similarly, the Oxford vaccine has varying reports, but is about 70% effective. And some people have therefore worried that the Oxford vaccine maybe isn't as good as the Pfizer vaccine. I have to say I work in Oxford. I'm nothing to do with the vaccine, but I don't think I'm biased. I would say if you're offered a vaccine, I would take the one that you're offered, because that is going to be the best one for you, because it will be the first one that you can get. Wouldn't worry too much about these differences between 70 and 90% effectiveness. What's certainly been true with the Oxford vaccine so far is that nobody who's received the Oxford vaccine has got seriously unwell. Nobody's been ill enough to need to go into hospital after getting COVID after having the Oxford vaccine. So even if it's not maybe quite as good as at blocking infection, it does seem to be just as good at blocking serious disease, which is one of the important things for vaccination. So although there are differences in the way that they work, although there are differences in the trial results, I think by and large, they're very good vaccines. And if you're offered one, I would take it. We can't make any recommendations about which ones might work better for people with certain types of kidney disease. because those trials haven't been done, and there really isn't any good basis on which to make such recommendations. There will be research going into the responses of people who are immunosuppressed, who have kidney disease, to see how well they respond. But that information might not be available before you're offered a vaccine. So I would encourage you really to get the first vaccine which is offered to you. So I think I'll probably stop there if that's all right, Fiona.
Thank you very much, Richard. There's just one other thing, which was a question that came up about, just to be, and I know we're going to be talking about this a little bit later on as well, but just to be clear, there is no particular vaccine that is or is not recommended for immunosuppressed patients.
Yes, that is the current recommendation from a committee you might have heard about on the news called JCVI, the Joint Committee for Vaccines and Immunisation. They don't make any recommendation one way or the other based on any prior disease.
Thank you. Just that there have been some media reports that I know some people get concerned about, but we thought it was important for us as the kidney community to hear from kidney doctors discuss that. So thank you for your clarity on that. Thank you. Okay, so now what we're going to do is we're going to talk about how well those vaccines work. And so what I'm going to do is I'm going to just hand over to Joyce, Dr. Popoola now, if I may, to ask her just to talk a little bit about what the vaccine does, how well it works. I know Richard's just discussed that somewhat, but there's a few questions about, does the vaccine prevent catching COVID, and how effective it will be for immunosuppressed people again, because there's a number of questions we've had about that. So I don't know, Dr. Popoola, Joyce, if we could ask you to speak to those points, please. Thank you.
Hello, can you see me?
We can,
so I
yes.
can see
Loud and
Fiona
clear.
on the screen.
No, you're there, loud and clear, thanks.
Okay, so in the first instance, so in terms of the efficacy of the various vaccines, just to emphasize, it doesn't matter which one you have, because all of the ones available in the UK have been approved by various bodies in the United Kingdom. So in terms of which one is more efficacious, works more effectively, is better to have, none. It's the one that's offered to you. So just to focus on the questions that were actually asked, a lot of misinformation has been going on, just as Professor Frankel alluded to. But I think the people that you trust are the people that have been looking after you over these years. So if you've got any worries about things, why don't you just ask them? Then focusing on the question, which, okay, so what percent does a particular vaccine have in terms of its effectiveness? Well, you might have heard figures touted about like 70%, 90%, 100%, 94, 95. It doesn't really matter, because all the WHO wants is that a vaccine has more than 50% effectiveness. So what's the percent likelihood of the vaccine being effective in someone who's immunosuppressed? And there'll be several transplant patients on the call, people with vasculitis who've had immunosuppression, nephrotic syndrome. Well, one of the things that has happened is that the government has actually said that, well, they want to make sure that if you are on immunosuppression, that you don't get your vaccine extended to the 12 weeks, which has been recommended for most people. So that's being taken into account. In terms of the ideal, well, you're going to be closer to the ideal. So you should get your second vaccine within 6 weeks. And is that likely to be enough to enable you to get some immunity, enough immunity? Yes. Bearing in mind the WHO, would there be a delayed build up to maximum coverage? Well, what we've heard is that, okay, so you get the first vaccine. In with that first vaccine, in about 2 to 3 weeks, you will have some degree of coverage. But in order to get that prolonged coverage and in order to get the maximum coverage, you do need to get the second dose. How much immunity will a renal transplant patient get after the first vaccine? Well, if we think about it, the trials weren't actually done in immunosuppressed patients, but we've had immunosuppressed patients being vaccinated since December. And there are currently trials to try and understand how much immunity they're gaining. I will say something, this isn't the first vaccine that we're giving to our immunosuppressed patients. Patients have had influenza, pneumovax, and a number of other vaccines, and we know that these do work. So there's no reason to suggest that this vaccine shouldn't be effective in immunosuppressed patients. And one thing I'd like to highlight is when we talk about vaccine, it doesn't mean that people won't get any infection at all. Because remember, it's on a spectrum. So you could find that you're having just mild symptoms, completely asymptomatic. You could have an infection that takes you to hospital, that you're needing oxygen support, that you're needing intensive care. And then there's the extreme that you might not make it, that you could die. Now, having a vaccine, it shifts the curve all the way to that perhaps you might get the infection, but it won't manifest as an infection, or you'll just have mild symptoms. And that's what we're trying to achieve. It's just another thing I just wanted to emphasize, the fact that if you've had the vaccine, you do need to make sure you stay shielded until enough of the society have had the vaccine, because you could then end up being infectious to others. So how well will they work? We'd say if they're taken as we're advising them to be, as the government's advising, they'll work adequately. Which is the best vaccine for me? The one that you receive. And then in terms of new variants, now that's a good question in terms of, we've heard about the UK variant, we've heard about the South African variant, and those are only the ones we've heard about because apparently there have been hundreds of other variants. Now, so far, from what the studies have shown, because the vaccines are predominantly focusing on the spike protein, all the scientists so far feel that with what we've seen so far, because the variation, it could be just one little part of a protein, what we call an amino acid that is variant. So you've still got the whole of the rest of the spike protein that the vaccine is still recognizing. And even the UK the UK variant, which has about 12 areas, they still believe that this vaccine will be, and in fact, the 3 vaccines will be effective against it. There will be more vaccines coming out, and already there are about 50 vaccines around the world. But we in the UK have chosen 3, and they're 3 of what appear to be the best from the publications that have come out. I think the last thing I'll just mention on that is that this is not likely to be the end of development of vaccines. And over the coming months to years, there'll probably be new variants developing to focus on the particular variants of viruses, similar to what we have with the flu vaccine. But for what we're seeing in the environment at the moment, these vaccines appear to be adequate. I think I'll stop there, Fiona.
Lovely. Thank you very much. Thank you, Joyce. Just one really, really swift thing, which is I don't know if you know anything about the antibody injection alternative to the vaccine. That was a trial that people were working on. I don't think we've heard any more about that trial, have we?
No, in fact, there are about 2 trials looking at antibodies, injecting antibodies, and it's kind of on a similar principle to when we were thinking that, okay, if we take convalescent plasma, that's plasma from people who've already had the infection, because it will contain some antibodies. So in a similar vein, but more targeted, there are about 2 trials that are running, and actually from London here, and I'm sure around the world. They're still in early stages. I think 2 of the main ones started this December. So it will take a few months before we start seeing results come out. So what we have at the moment, the best tool we have is the vaccines.
Brilliant. Thank you very much indeed. Thank you, Joyce. I'd like to now press on, if we could go to the next slide, please, Julie. And Joyce just mentioned a few things about first and second dose, but we've had a lot of questions about that. And I wonder if I could invite Andrew just to come on briefly and just talk a little bit about the first and second dose regime.
So the government made this decision to extend the interval between the first and second dose from 3 weeks to 4 weeks, which was what was really recommended, to 12 weeks. And this has had actually a significant impact in terms of information that's flowing around the system. And the government made this for very, very good public health reasons. And they made the decision in an informed way, but it has added to confusion about the vaccine. And what I want to give you is some information that I think things we know, and be honest also about things we don't know. The fact of the matter is, and this is why there's such a debate in the media, the vaccines were studied in a particular way with a particular sequence. And so that is how we believe that the vaccines are going to be delivering the effectiveness that is in the published studies. In fact, for AZ, there was a subgroup that was longer, so we're less concerned about that. However, in fact, extending the interval may not necessarily have anything that's detrimental and may even be positive, because many other vaccine regimes that we utilize involve having 2 vaccines at a time distance that's quite separated, months, 3 months, 6 months. So it's not unheard of at all. Indeed, it's probably more usual to have your first vaccine and then a booster at 3 to 6 months. Secondly, we have pretty good data that you get very good protection after the first dose by the 3 weeks. We perhaps have less data as to what happens subsequently and how long that lasts, but there's every reason to believe that that would last through at least through the period of 3 months. So I also would say, and this I think was mentioned earlier by Richard, there are studies now ongoing looking at the impact of different schedules with different vaccines. So we have more information we can give you. But to summarize, what I would say to you is don't get too bogged down by this debate about the delay. It is almost certainly not going to affect the protection offered by the first vaccine. It will probably turn out to be just as efficacious in the long term. Remembering what Joyce said, that we're probably all going to need to have a vaccine every year or two anyway, as we do with flu. And the information will become more available. And we will get that out there to you through the Kidney Care UK website when it becomes available. Just want to finish on something I think was covered by Joyce, that patients who are due to start immunosuppression are being offered this opportunity to have the 2 doses within the 3 weeks, simply to be able to give them that benefit before they start high dose immunosuppression. So that is something that is now changed and is now being offered to patients. Fiona.
Thank you very much. And that question definitely just came up on the ask list. Okay, there was just one other question, Andrew, before you go off, and I hand back to Joyce for the next lot, which was about mixing doses. I don't believe that's recommended, is it?
No.
And will people be offered a dose of a different vaccine if the first one somehow runs out?
So let's be clear. There's a lot of misinformation. The Pfizer vaccine is going to run out. Europe's going to stop our supply. Various other things are going to happen. I think that the strategy will be absolutely to ensure that if you've had one vaccine as your initial, you'll have the same subsequently. I don't think there will be mixing and matching unless we get further information that becomes available over this period of time. And I would suggest to you, don't worry about it at this stage. Get your first vaccine. Your treating doctors and your treating teams will be doing their best to ensure that they deliver the second vaccine, or that whatever is delivered to you is delivered in a way that is safe and beneficial to you. My prediction is that we will see most people, the vast majority, in fact, almost everyone, adhering to that same vaccine protocol.
Thank you very much for answering that question. It's very, I think that's quite reassuring. I hope others feel the same. Can I ask now, Joyce, to pick up a couple of questions, please, that we've had on the side effects relating to pregnancy and fertility. There's been a little bit of noise and discussion about that, and one or two questions about children being considered for vaccine. I wonder if you could address those, please. Thanks.
Okay. So I'll start with the children. I mean, most of you will have noticed that actually very few children, I'm not saying no children, but very few children are being affected by this infection, and particularly not the very young, which was why the government was keen to get the children back to school. So one thing with trials, and a lot of what we're doing in medicine is based on trials, is that we don't like to start doing trials on children. So most of the trials were done, in fact, all the trials were done on adults. So these vaccines haven't been trialed in children. And who are we describing as children? Well, for the Pfizer vaccination, the trials weren't done on anybody less than 18. But for that vaccination, they are actually using it in young people down to the age of 16. And some of you that are constantly listening to the news, you'll know that in Israel, they've put out the biggest rollout. They've already vaccinated 1/3 of their population, and they've moved to vaccinating the 16 to 18-year-olds. But this is with permission of the parents, and this is only with the Pfizer vaccination. Now, the third vaccination that hasn't been mentioned so much because it only just came on board is the Mrna vaccination. So both the Mrna and Pfizer have been licensed down to the age of 16. The Oxford vaccination is licensed down to the age of 18. Neither of these, the children are not the focus at the moment. And later on, I think we'll see the way in which we're being guided to vaccinate our population as a whole in the United Kingdom. But there will be some young people who do need to be vaccinated, because we have young people who've had transplants, who have vasculitis, other immune conditions, particularly nephrotic syndrome. And so for those, if it's the Pfizer vaccination, down to the age of 16, they will be able to be vaccinated because they also fit into the group that we describe as the vulnerable. Also, we have some young people who are waiting for transplants. So once again, they've got quite bad kidney function, they'll be considered for vaccination, but only down to the age of 16. Will this change? Very possibly, but not just yet in the United Kingdom, because in the States, they've been looking at some of the teenage children, but this is only as part of a trial. And then moving to pregnancy. So pregnancy, when they first brought out the Pfizer vaccination, which was in December, it was strictly not for anyone who was pregnant and not for anyone who was planning to get pregnant. But pretty soon, in fact, I think after, because I was on the vaccination team in my hospital, after we'd been giving the vaccination for about, I think it was just about 3 weeks, that guidance changed. And now several pregnant women have gone on to have the vaccination. And there haven't been any reports of any significant changes in the pregnant women. Because one thing we need to think about is we need to think about what is the cost of a woman developing COVID infection as compared to her being immune to the infection and having the mild symptoms that most people get from the vaccination, pain in the arm, maybe a bit of myalgia, a bit of tiredness. what is the opportunity cost? Because bearing in mind, it's not only the mother, but also the growing baby. So pregnant women are now able to have the vaccination. And then another question, and I think because of those initial guidelines saying that if you were planning to get pregnant, that you shouldn't have the vaccination, I think that's why the thought process, some people were wondering, does it affect fertility? Well, there's no reason to think that any of these vaccines that we're using in the United Kingdom should affect fertility. From the way they work, they've got nothing to do with the hormonal axis. And there's no indication at all that they would affect fertility. So they are being given to pregnant women. They are being given to young people up down to the age of 16 for the Pfizer vaccine, down to the age of 18 for the Oxford vaccine. But at this time, only for those children who have the need, maybe they, like I said, they're on immunosuppression, or maybe they're waiting for a transplant. I hope that kind of answers the questions that we had on these two areas, although I'm sure there'll be more.
Thank you, Joyce. And we've got a lot of questions coming through. So what I'm going to do is actually, because I think you broke up during your previous set of questions. So what I'm going to do is, Andrew spoke about this, and I know you've spoken about it as well. And what I'm going to do is I'm going to hand over to Richard now and ask him to additionally comment when we, if that's okay. And that's to do with safety and side effects. But we've also had several questions come through, and I think, Richard, you'd be a great person to answer this one. The first one is, I don't know if you've seen it on the chat, so if we can go to the next slide, please, Julie, as well. And the question that's come up a couple of times, just for super clarity, the AZ vaccine is not live, but could you just state that again for everybody's benefit, because it's come up on the chat, and I just think we need to address that.
Yeah,
to make sure
absolutely. It's a bit confusing because it is what's called a viral vector, but it cannot cause infection. So it doesn't matter whether you're immunosuppressed or not, it's not going to establish an infection in your body. So it doesn't count as a live virus. It's not like some of the other, like the zoster vaccination, for example, which transplant immunosuppressed people shouldn't have because that is live virus. It's not one of those. So it's no reason not to have it if you're immunosuppressed.
Thank you for being so clear about that. Thank you. And there was another point that's come up quite a lot. It's been answered several times, I think, in the chat too. But just to be double clear, there would be no reservations that you would have about recommending somebody who is expecting a transplant to have any of those vaccines.
No, no. And Joyce has already talked about the importance of getting the vaccine before, if possible.
Yeah, absolutely. But a couple of people, I think just that the sound broke up slightly, so I thought it was worth having a third person just speak to that. And just finally on that point, it's just about people who are waiting for a transplant. So they're on the transplant waiting list. They may be on dialysis or they may not be. Just about the fact that they should expect to be able to get their second dose of the vaccine within a period of time. That has been recommended. Just if you could just talk through that again. I know Andrew and Joyce both spoke about it, but just explain that again. Thank you.
Yeah, so that national committee, the JCVI, have issued guidance on this, that people who are coming up to a transplant, so who are not yet immunosuppressed, but know that they are going to be after their transplant, then the way of them getting the best effect from a vaccine, it would be to have both doses before they get transplanted, if that's possible. So JCVI have suggested this is one group of people who may not have to wait as long as the current recommendation for 12 weeks. So that is, to be honest, and I think we have to be honest here, that is probably likely to cause a bit of confusion at some of the vaccination centres, because this is a fairly niche area. We're familiar with it, many of our patients are, but many other people won't be. So just be patient while you explain it.
Thank you. And that could be between 3 and 6 weeks rather than the 12 weeks. That's the recommendation. So I hope that's made it clear for everybody. Can I then just ask you then to comment on a few further questions around side effects? I know time is moving on, but these are very important questions that people have had. So perhaps you could just run through the side effects of the vaccines and we've had questions from people who are both on home dialysis and actually people with transplants as well. And I wonder if you could just comment on whether they'd be safe for kidney transplant patients with multiple complications, or anything else about how long to look out for them. Thank you.
Yeah, so many of us will have had vaccines before for many different reasons, and many of us know that after a vaccine, you don't always feel on top of the world, that you can feel, well, you can have a sore arm, certainly, and you can feel a little bit lousy for 24 hours after it. And these COVID vaccines are no different. However, in the vast majority of people, these side effects just wear off. You can use paracetamol and just not try to do too much, and then the side effects should wear off. But they are fairly mild, fairly typical for a vaccine, and nothing to be concerned about. And I'd say this would be true whether you're a hemodialysis patient or a transplant patient, with multiple complications. Indeed, it's probably even more important that you have the vaccine in that situation, because unfortunately, were you to get COVID, it could be more serious for you. Does anything, when we say about vaccine safety, what do we mean? Well, we don't, as far as we know from the trials which have been done, there are no serious side effects of these vaccines. Things have moved quite quickly, so you can't put us on the spot and get us to tell you that these are 100% safe, but we could say that we're as confident of these vaccines being safe as, say, for the flu jab or for many other vaccines that you might be offered. So I wouldn't avoid these vaccines on the grounds of safety. We have pretty good evidence on them, and that evidence is getting better every day. I can see a question on long-term side effects from the vaccine. We have no data to suggest that there might be. We know that there definitely seems to be long-term effects of COVID. So again, another reason to have the vaccine. But probably in the interest of time, Fiona, I'll leave it there unless
Thank you. And what would be enormously helpful if Joyce could just come on now as well, if you could both just stay on view because of the interest of time. I think you've probably covered most of those questions that were raised, and I just giving Joyce the floor just for a minute in case there's anything that she feels that we needed to add in about side effects, whether they would depend on what drugs you take, and whether somebody's asked a specific question about a theoretical risk on vaccination, but that I think we've covered most of that. But Joyce, just whether there's anything additional you want to add into what Richard's already covered.
Yeah, I mean, we have heard about people asking a theoretical risk. Could I lose my transplant? Could I develop rejection as a result of the vaccine? We've not seen it. We've not heard of it. So the emphasis on the live vaccine. And then this thing about, if I've had a transplant, when can I be vaccinated? Ideally, you want to be vaccinated when your immunosuppression is at the maintenance level. So you certainly don't want to be vaccinated within the first month. It seems most units are suggesting maybe after 12 weeks when you've got your medications on a baseline. And there was one other little question I think I ought to speak to. Somebody was asking, when I'm being vaccinated, do I need to reduce my immunosuppression? Most certainly not. You don't change any of your medications. And just a little thing, when you go for your vaccination, even though your doctor has sent you there, the person vaccinating you will still go through things with you to make sure there's no reason why at that moment you shouldn't have the vaccination.
Thank you. I think, and there was just one question that's just come through. I think it might have been for me, actually. I'm not quite sure, but just to say, I did have my vaccination on Saturday and I didn't get any, I just got an aching arm. And I suspect that's quite common for most people. And most patients I've spoken to have said the same. It's not that those other side effects cannot occur at all, but I just thought I'd share that because the question had popped up. So. Okay, thank you very much. I think, again, because time is moving on, there's a lot there, and we'll try to answer as many questions as possible live, as we've said. And what we'll do is that there's been a further few questions that have come up about allergies. So I'd like to invite, I forgot to put my video on. That's a bit of a rookie thing to do. And I'd like to invite Andrew just to come in and just talk a little bit about interaction with other medicines and allergies as well, if I may. And Julie, could you put into the next slide? Thank you.
So, as Joyce said, when you go up to get your vaccination, you will actually be reassessed by a vaccinator who is trained and who knows exactly what the rules and regulations are in relation to determining whether you can have the vaccination. If you've had allergies, really, unless you've actually had an allergy to a component of one of these vaccines, which is most unlikely, it's safe for you to have the vaccine. So if you've had penicillin allergy, it is probably, well, in fact, it is safe. In fact, we shouldn't use the word safe. There's no evidence that you will come to harm. Your vaccinator will assess that, and they will ensure that you get the appropriate vaccination to suit you. So you will not miss out on vaccination. We also know there's a lot of interest and questions about various medications that people are being treated with. There is no evidence at all that the vaccine will interfere with any medication. So whether you're on immunosuppression, as Joyce says, you don't change any of that. Your blood pressure treatments, you don't change that. And some of the other immunosuppression, the novel agents, we've had a number of questions about people who are on what's called adalimumab, which is an anti-TNF antibody used to treat psoriasis, inflammatory bowel disorder. No suggestion at all that this vaccine will interact with that. So essentially, you will be treated in exactly the same way as everyone else. There's only one thing that the additional thing that two other things the vaccinator will ask you. Are you on warfarin or do you have any blood thinner? And then they will manage you. If you are, they will tell you how they will manage the vaccination, because and that's nothing to do with the vaccine itself. It's to do with the injection into the muscle. And if you've had COVID in the previous 28 days, you've tested positive and you've been unwell, or you've just tested positive, they generally will ask you to wait for 28 days after you've tested positive for COVID and had COVID. But otherwise, vaccination should proceed irrespective of allergies, drugs, and other illnesses.
Andrew, can I just pop in and ask a quick question there that's come up? There's no reason to stop any immunosuppressants if you have the vaccine, is there? Or indeed if you have COVID?
Yes. So, and I think Joyce mentioned this, absolutely. If you're going for your vaccination, please do not change any of your medicines at all. If you are a patient who's a transplant patient, or you're on immunosuppression and you develop COVID, it's really important you let your treating renal unit know so they can provide some augmented follow-up and give you advice about what to do, knowing you as the individual and knowing the medicines that you're on. You never make any change in your treatment without getting advice from your renal unit. So they'll be very keen to help you.
Brilliant. So the answer is always to ask your renal unit. Also, can you just confirm how long you have to wait after having COVID before you should have a vaccine?
28 days is what is in what's called the Green Book, the guide. So it's 28 days after you've been tested positive.
Thank you. And then finally, for people with other stages of CKD, we're going to talk about prioritisation in a moment, but there is no reason. All the messages we've been given are for anybody with CKD. It's not, I know we've been talking a lot about people with late stage, but it's just as suitable for somebody with CKD3 or CKD4.
Sorry, and we really need to remember that the kidney community contains people who have got all stages of kidney disease, some who've got normal kidney function or just say got nephrotic syndrome, people who've got advanced kidney disease, people on immunosuppression, transplant and dialysis. I think that everything that we have been saying is pertinent to the whole spectrum of the renal community.
Yeah, absolutely. Thank you. And I think that's probably all for this section. I know we've got a lot more questions there. So what we're going to do is we're going to press on. And I can see a few questions have come up about what happens after we've been vaccinated. So I think it's a good moment to invite Richard to come back in, because I know, Richard, you can only stay till 6 o'clock, but we'll continue onwards after that. And Richard, I wonder if you can just talk about what happens after we've been vaccinated and yeah, where we are now with that.
Okay, so at the moment, the guidance is that even once you've received your vaccine, the guidance is that if you were shielding beforehand, you continue to shield. And that, I'm afraid, means that working from home if you possibly can, and so forth. I think before the shielding advice will be lifted by the government when we can see the effect of vaccination and the effect of other measures in the population to get the prevalence of the virus low in the community. But until that time, it's important that you continue to shield. I know that's a disappointment to many people, because I think many people have seen the vaccine as their tickets back to normality. It's certainly a very important part of it, but unfortunately, until we've got this virus properly under control, then we do need those people who need to shield should continue to do so, and use all the other measures, such as washing hands, face masks, social distancing. When you do see people, remain just as important as before. So I'm sorry if that sounds a bit disappointing to some people, but it is definitely the current advice and the best advice that we can give.
And can I confirm then that means after your first dose, we wait 12 weeks, as most of us will need to do. Certainly that's my expectation. I would have to wait at least 12 weeks before being called for a second vaccine, as someone with a stable transplant, so not waiting for a transplant or anything like that. And that even so, after the second dose of vaccine, we will still be advised to continue to be as careful as possible while the infection level is so high in the community. And that's the advice we have at the moment.
That's right. And I think the advice to stop shielding will come in due course, but probably won't be dependent on whether you had your vaccine or not necessarily. At that point, they will have made sure that everybody who really needs it will have had it, and then they will wait for levels to fall, and then they will lift the shielding advice.
Right, yeah. And so we should just confirm that at the moment, because shielding advice is out there, people should not be asked to be going into work.
That's correct.
At all, because that's supported by government advice as well.
Yeah.
And that's something that Kidney Care UK, and we've done a lot of work and had a lot from people about that previously, and that was something we'll continue to support for people. But if you do have any challenges around that or any concerns about employment, just come talk to us, because our advocacy officers may be able to offer advice on that particular thing. Okay, is there anything else, Richard, just for you, because I know you had to disappear, about travelling? We've been asked a couple of questions about travelling and about visiting family. I think the travelling one is off for the time being, but perhaps you could comment on that.
Yes, I mean, follow the best advice, but I'm not sure that it would be ideal to be travelling. Certainly if you're shielding, then I don't think international travel is really possible. If you're not shielding but you have some other form of kidney disease, then I'd probably take some advice specific to your condition, but I would be cautious about that. And again, seeing families, sadly, at the moment, the current guidance is that two households cannot mix unless they're in a support bubble. So that should continue to apply. Right.
Okay. Thank you. Thank you very much indeed. And I can see we've got a number of questions about people who should expect to get offered vaccination and so forth. So I'm going to ask Joyce to take the floor now while we talk a little bit about, and where Julie perhaps goes on to the next slide, please. And what we're going to talk now about is the rollout programme and who should expect to be invited to receive I was going to say a transplant. You can tell which community I'm in, to receive a vaccine and when. So perhaps those of you who can't see the screen, that's fine. This will be visible afterwards. But what it is the list, the priority group of people, and at the moment, people who are clinically extremely vulnerable, which includes those of us with transplants, those of us with CKD5 and on dialysis, are at priority level 4. And those with chronic kidney disease, slightly earlier stages, will be at priority level 6. So Joyce, over to you. Thanks.
Okay, thank you. So many of you, some of you are confused about the way it's happening. If you can just remember that it's divided into 9, and most of you on this call probably fit somewhere between 4. And if you've reached into your golden years, then maybe you're in 1 to 3, but most of you will be on 4. So the first 2 are based on either you're in a care home, you're a carer within the care home setting, or you're over the age of 80. And the buzz term is that over the age of 80. A large proportion of these individuals have been vaccinated, and we're now on to 3 and 4, although it is somewhat variable around the country. But many of my patients who have had transplants have had their call-up, so do expect to get your call-up. Now, I will say, some of us are a bit unsure, should I take my vaccine or should I not? I would say that tonight and maybe tomorrow is the time to think about it, because the way they're working through it, they won't be able to keep coming back to ask you, are you ready now? Are you ready later? Because now is your time. It's time for those in priority group 4 to get their vaccination. And what I'm encouraging everyone to do is actually go out there and book your appointment at the soonest available opportunity. There will be some caveats to it, like individuals who've recently had their transplant. Please talk to your transplant team. Individuals who've been ill recently, or who've been in hospital, or perhaps even who've had COVID. We heard Andrew Frankel telling us that we have to wait 28 days after the infection if we actually had COVID infection. It is being done in a systematic way, even though it might not totally feel like it. Other people are asking, so where precisely will I get my vaccination? It could be in a number of places. It could be at your GP surgery, because some vaccinations are being delivered to some GP surgeries, but not to all. It could be a standalone center. I've even heard of it happening in a cottage hospital, even in a church, and even in a mosque. It could be, if you're a dialysis patient, it could be that your doctors and nurses come to you in your dialysis unit to give you the vaccine. But I must say, they won't be able to keep coming backwards and forwards. So ideally, it's almost, I'm encouraging you, make up your mind that when I get my opportunity, I'll take my vaccine. And then the other big center is the hubs. So what we're calling the vaccination hubs. So these are often in major hospitals, or I think there's one in East London that's in like a Nightingale Centre. So these are places where often it's mainly the Pfizer vaccine that they're giving. And they're in hospitals, yes. Some people are worried, if I go into such a setting, is it going to be crowded? Will I be able to keep to my social distancing? I will say most of the times in these places, it's actually well set out. You can't just, it's not like a cell that everybody rushes there at the same time. What happens is that people are given an appointment, and then it's done in a staged fashion. And then there are multiple cubicles where you get to get your consultation before you have your vaccine, and then you have your vaccination. I think that touches on it. So those of you that are in that category 4, the extremely vulnerable, all of you who are on dialysis, all of you who are CKD stage 5, approaching needing a transplant, those of you with nephrotic syndrome, those of you that are on immunosuppressants for any reason, you fall into that group 4. So I think I should stop there just in the interest of time, but I just want to add that some of the young adults who are maybe 16, they fall into that group as well, 16 to 25, even to 30 young adults. They fall into that category 4 as well, if they're transplant patients or are on immunosuppression or are CKD stage 5 waiting for transplants. If you've got doubt, you don't want to all suddenly start phoning your units. But if you've been offered maybe in the GP practice and you're worried, should I? Then yes, do speak to your renal units. Is that okay in the interest of time?
Yeah, thank you, Joyce. I know there are a lot of questions and I've just been running through them but you've been as clear as possible there with everybody that there will be slightly different ways that this will be rolled out. If I could just also mention to patients, just keep your eyes on your phone, your email, because depending on your unit and where you're at, you may be asked through your local GP or through your renal unit. There was one question that somebody asked, which is, there is no problem, is there, with having the vaccine if you are actually physically on dialysis at the time, Joyce?
No, there isn't. There isn't. It's and in fact that's happened in a number of centres. So
yeah.
There is one thing I just wanted to mention though, the fact that for some people who perhaps are frailer, sometimes you can actually have it in the home setting, but perhaps that's not the first choice, because you can imagine that will take the personnel away where they could have vaccinated 10 people, and then the time of travel to and fro. But for those of you that need that, and that's the only option, that's an alternative as well.
That's really helpful, I think, for everybody to know that. And just a final question, if I may, just for now, which is about family members. So we've had quite a lot of questions about people who are clinically extremely vulnerable, who will be getting their vaccinations now. And I wonder if you could share anything, because at the moment, my understanding is, and it does change quite a lot, that family members will only be offered if they themselves are vulnerable or by age, and that will come later on for them. Is that as we understand it now?
Yes. Am I still on the?
Yes, you are.
Yes. So for the most part, yes, it will come later, but there are some situations like where an individual is the carer. There are some circumstances where, yes, they can be vaccinated alongside, but that's not the norm, if that answers that question.
Yeah, it does. And I think it's worth saying to the audience that is very much a developing thing, and something that we, Kidney Care UK, and others I'm sure will be doing more work on over the next few weeks to understand what those plans are and how they are rolling out as the vaccine rolls out to our community. Thank you very much. Right, so time is moving on, but I can see many people have stayed with us, which is great. So I wonder if I could ask Andrew now to come on, and we've had quite a lot of questions from people who are living kidney donors or people who were born with one kidney. And I wonder if you could just speak to those questions, Andrew, please. Thank you.
So we often do get questions about people who've been living kidney donors and people with one kidney in relation to how they're affected by COVID. And it's not unsurprising that they've asked the same questions about vaccination. Essentially, if you have one kidney and you have been a donor and you've got reasonable kidney function, you are the same as every individual out there. And also, to be frank, even if you have some degree of kidney disease, so your kidney function isn't normal, then from a vaccination perspective, you are treated in exactly the same way, and you will respond in exactly the same way as everyone else. I would just remind people that something that we said in the very first session of this some months ago is, of course, as your kidney function declines, so your potential risk if you get COVID does increase in relation to the severity of the illness you suffer. But remind people again, it's not just severity of kidney disease, there's a whole range of factors that will determine your risk. But from a point of view of vaccination, irrespective of the numbers of whether you've got one kidney or two kidneys or your kidney function, you will respond in exactly the same way to the vaccine. And I would just reiterate about the living kidney donors. I know Fiona said this is something that Kidney Care UK are working on at the moment, and I know that people are thinking about. People will have a strategy for planned living kidney donation. And that strategy is around COVID, ensuring that the recipient has been appropriately vaccinated. And I anticipate that we will see some movement here, and that if you are the living donor living with that kidney donor, it would, in my mind, be logical that you get vaccinated at the same time for when they come back. But we have to wait and see, and you need to discuss this with your transplant unit.
Now that, thank you, is a very important point as well to have made. I wonder if we could just move on to the next slide before we finish, because there are still a range of outstanding questions. And I wonder if the whole panel would be able to come back on, or the remaining panel will be able to come back on. So that's Andrew, Joyce, and I know probably or possibly Becky and Fiona, if you're able to do that, because there are a number of things that have come up today. I think it's probably worth just going back to from the question point of view. And I don't know, Becky, whether you want to come on and just summarize again for everybody the sort of key points about when to expect your vaccination, the issue that we just mentioned, just to be clear about people who are on the transplant waiting list, not people who are already transplanted, and any other points that you'd like to comment on.
Yeah, no, my video, the host has stopped my video, so you can't see me.
Well, hopefully the host can Julie can give you back that opportunity. Becky, do you want to? We can hear your voice loud and clear. Okay. Oh, there you are. Becky, would you like just also to recap on some of the key points, because you and the other Fiona have been answering those questions, just to recap on some of those for everybody's benefit.
So I think one of the areas of confusion still remains on the questions around the timing of your second vaccine in 2 different groups, and it'd be really helpful if we had clarity on that, which is the 2 groups are immunosuppressed patients and transplant patients who are transplanted. And there seems a lot of confusion about whether it should be 4 weeks, 6 weeks, or 12 weeks. Joyce, would you be able to clarify that for everyone? Because I think that it has been answered several times, but I still think there's a lot of concern in those 2 groups of individuals specifically, those people on long-term immunosuppression who don't have a transplant and those who are transplanted. When should they get their second vaccine?
Okay, so now part of the reason that it's confusing is because it's been changing so frequently and so much. When the first vaccine that came was Pfizer. When it first came, it was said that you have the first dose, and then within 3 to 4 weeks, you have the second dose. With the Oxford vaccine, first dose, and then 4 weeks. Now, it was noted, and there was a lot of deliberation through various committees around the country, both government officials, health officials, specialists in immunization, and it was thought that the ideal thing would be to get as many people vaccinated as possible, as early as possible, especially because at that time, the viral count was going up. Now, this is constantly something under revision. And so because of that, it was extended, and it was said that then the next second vaccine would be given at 12 weeks. So that was the case for everyone. Now, it's actually only just this week that has been revised, such that those who are on immunosuppression, in fact, whether they're transplant patients or whether they're other patients, if they're on a significant amount of immunosuppression, the aim is that they will have their next vaccine within a shorter period. Now, because all the logistics, making the changes to the logistics, it might be difficult to say that, oh, all of you are going to get your vaccine at 3 to 4 weeks, depending on what vaccine you have. So there's some leeway, and the aim is to try to get it within 6 weeks. Then some of you who are not taking immunosuppression may say, well, why these people? Why are they getting this preferential treatment? The reason is precisely because of some of the questions that have come through, that by virtue of being on immunosuppression, could it mean that maybe my immune response to developing immunity will be slower or less so if I'm on that wider gap? And that's why for this particular group, they're going to try their utmost to shorten the gap relative to the new guidelines of it being after or up to 12 weeks. Does that answer the question?
I think it probably does, but I think what I'd also say is that if you're really not sure, most people who are on long-term immunosuppression have a kidney doctor that they could
Who
talk
they
to a
could go to.
transplant nurse to find out where they are. And I think the difficulty is likely to be getting that communication between what we recommend and the vaccine centres who are delivering the vaccine, which is something that I think is going to be a challenge. The other thing I've had questions about is around when will you be called up? And I know that, Joyce, you've covered that a bit, but what I'd say is, you know, if you're clinically extremely vulnerable on the national sphere, because you will have got a letter to say you should be shielding. If you haven't received that letter, but you think you are clinically extremely vulnerable, it is worth talking again to your kidney doctors, and they can check whether you are nationally registered as clinically extremely vulnerable. Now, some people, particularly those people with more advanced kidney disease, who in March may have had a kidney function of 20%, may now have drifted into a position where they are now clinically extremely vulnerable. They may have started dialysis, they may have had a transplant, and that may not have been picked up nationally that you are clinically extremely vulnerable. So what I'd say that this is really important in terms of getting your vaccine invitation, because the invitations don't come from your GP, they come nationally, and your GP has no control really on who can be invited, except to make sure that you're on, then you are recognized as clinically extremely vulnerable. So if you feel that you have factors that make you in that group, and that group on our website, on the Kidney Care website, we talk about what those factors are. So do go and check on there and see, do I meet that? It is important that you make sure that you have received a shielding letter, when the last shielding letters, that will tell you, yes, I was on the list, and then you will get the vaccine. The other thing I'd say is that there's geographical variation, and I'm sure that some areas are now doing tier 3 and tier 4, and some areas are still doing tier 1 and tier 2. That's how the vaccine has been allocated, because there are some factors that meant some areas were given more vaccine first than other areas. So you will be called up. They're hoping that the majority down to tier 3, 4 will be done by mid-February. If you're below tier 3, 4, I wouldn't be expecting a letter at this point, although you may be lucky and get one. But just because you know someone in one area who has had it and you haven't had it doesn't mean you've been forgotten. Different areas are doing it at different speeds. So please don't worry about that. Is that any help, Fiona?
Thank you, Becky. I know that people have had a lot of questions, and I think it is just worth reiterating. Wait for your letter, watch for your text, watch for your email, because there will be different routes through which you will be invited alongside other patients in your area. And so keep looking out for that, but don't worry if you haven't yet had that, because it is rolling out differently across the country.
Sorry, I've just been on my dialysis unit today, and I've chatted to my dialysis patients who generally were in a variety of age group. When I last went there, none of them had the invite, and they all received, all starting to get invites. They got it last week for this week. So it's not something you get for weeks in advance. Last time I went there, none of them had invites. This time I went there, several of them had had the vaccine, having not even had an invite a week before, and majority of them are starting to get dates through. So when they start working through your criteria, you will be contacted, and it can be quite quick when you're offered your vaccine slot.
Yes, and I think we all owe our dialysis units the most enormous amount of thanks, because I know that some of the units are absolutely engaged with vaccinating all their dialysis patients, which is why in some places where there are transplant patients who are also being invited at weekends, probably because there are some additional doses and things ready to do that, but it's very different in different parts of the country, and some people will be invited through their communities instead, and that will be what will happen as we roll through this. What I probably need to do now, because it's getting towards 6:20, is just go on to the next slide. Ask Andrew if there's anything else that you feel that you need to say at this moment, while I do a bit of a sum up for the event. Andrew, anything else you'd like to add?
No, I would just highlight that there's so much information out there. There's so much that actually may not be based on facts. There is also, of course, the fact that we don't know everything, and we need to be clear when we know things and when we don't know things, and that you, as a person with kidney disease or disorder, need to be able to know where to go to get the right information. I'm sure, Fiona, you're going to now point people to the right place.
Thank you very much for that reminder as well. Andrew, you spoke at the beginning about people naturally having questions and going to people that they trust for those answers. And I would absolutely emphasize that we will do our best, of course, as we've done for the last 10 months, to keep up-to-date information. Julie, could you just please show that slide again? Thank you. On the Kidney Care UK website, we have shared information from the, for example, from the British Islamic Medical Association, and you will have your own trusted people in your community that you would go to. But what we absolutely ask is that you use information from trusted sources. There's a lot around at the moment, but go to the trusted sources, just as you would if you were talking about, for example, an organ donation. I like to think of it like that. You would ask and make your decisions based on the evidence around. I should also say that this may be a help for some of our BAME colleagues and patients who may be listening, that we are going to be running a webinar aimed at discussing some of those issues and questions you may have. Our BAME engagement lead, inclusion lead, Amjid, will be working on that. Well, there'll be an announcement of that quite soon, so do look out for that on our website. I know there was loads of information here. We will be showing this on YouTube, so you can go back to it if you want to re-listen to it at any time or share that with others. We'll be doing another follow-up survey, so you can tell us what you thought of this, what else we need to cover. There is the link again to kidneycareuk.org/coronavirus, which is where we try to keep everything. If there are things missing on there, please let us know. If you need support on any of the issues that we've raised today, we talk to our advocacy officers. They can help with benefits, with other signposting, of course, and with employment issues and other things. We've got a fantastic team of those ready to help you. We have 3 counsellors now as well who are able to help, and of course we do have our grants programme. But we'd like to hear back from you. If you have any further ideas, do talk to us. You can get in touch down there, and we'll be running further events like this. And if you have other suggestions, again, as I say, please do let us know. Thank you so much. It's been, I think at the height of this, we had 365 people listening to us. So it's been absolutely amazing. The bottom right-hand side there, I've put our little keep your distance badge. You can still order those. They're available if you go onto the website and have a look for those. I was just struck by what Andrew said today, and actually, other experience. When you go out and about, we still do need absolutely to keep our distance while we're running through this high infection and period of us all getting our vaccination. So all those old things about washing your hands, keeping your distance, wearing a mask, they apply just as much as they ever did. And I'd just also like to say that I think you kidney patients, as well as our fantastic medics, but I think you kidney patients have been extremely brave, and it's been a really, really difficult period of time. And so thank you all for sticking with us. And I know we'll all get there. It'll take time, but we are getting there. And the vaccination programme is the best tool we have at the moment to help us to achieve or get back eventually to something near normal after this incredibly difficult time for all of us. Thank you all very much for coming, and keep in touch with us, and we'll be running more webinars in the future. Thank you so much for your time. Thanks then. Bye-bye, everybody. And thank you to our wonderful panel. Thanks, everybody.
Thank you.
Bye-bye for now. Thank you.
Thank you. Goodbye.
Bye.
Bye. Bye. Bye. Face, mask, space, social distancing.
Thank you.
Bye.